Welcome to another PowerPoint presentation by Phlebotomy Solutions. In this PowerPoint presentation, we'll be looking at special blood collection procedures. Let's begin with bilirubin. What is bilirubin? Bilirubin is described as a yellow-orange substance, which results from the breakdown of hemoglobin. Now, bilirubin is a waste product from the breakdown of old red blood cells, which is processed by the liver for removal from the body. Abnormally high bilirubin levels are often indicative of liver disease. The result is jaundice, yellow skin, and yellow in the white of the eyes. Now, what would be the purpose of this test? Well, one, we will be determining liver disease. Another would determine blockage in the bile duct. And another is neonatal jaundice. Again, all these are all associated with issues with the liver. And some of the precautions we need to take when drawing this type of blood sample or checking for high bilirubin levels, we need to minimize exposure to light. That is referring to the blood sample itself. When we are done collecting the blood, we need to minimize exposure to the light. This is a sensitive test, and we need to make sure that we keep it light exposure to the bare minimum. And by doing so, we might be using some light blocking amber colored containers. Or if we don't have that, we can use aluminum foil to wrap around the tube immediately to prevent the minimum exposure to light. Now let's talk about the glucose tolerance test, which we test for high or low sugar in the body. And the administration of glucose is to determine how quickly it is cleared from the blood. Now the reasons, or some of the reasons for the test being ordered, is one, to check for glucose levels, checking for diabetes, insulin resistance, and a basic insulin overview of typically glucogen. Now, the test is usually used to test for diabetes and the things listed, and the glucose is most often given orally, so the common test is technically an oral glucose tolerance test, or an OGTT. And the test may be performed as part of a panel test, such as a comprehensive metabolic panel. And again, we evaluate body's ability to metabolize the glucose or the sugar. Now that is referred to usually typically as hyperglycemia or hypoglycemia. And hyper is the high and the hypo is the low. Think of it this way. When you give your children a lot of sugar, they become, we say, hyperactive. Well, hyper is high. So hyperglycemia is high sugar, while the hypo is low sugar. And if you can see, sometimes it requires certain things like no food or drinks for 8 to 12 hours prior to the test. And then they drink the glucose, and the blood is tested 2 hours later. And of course, high glucose levels is potential for diabetes. So again, this is the glucose tolerance test. Now let's talk about the preparation and procedures. One is balanced meals. Now the doctor might request the patient to have a certain meal time cutoff, let's say nothing after 8 o'clock. And before that, maybe a balanced meal of certain types of foods to eat that they want the patient to do before they cut off the meal, or even afterward, what they can and cannot eat afterward. And typically, the water intake is also mentioned, that they might have a little bit of water or none. Now, typically, they're able to drink just a little bit or sips of water that will not harm the test at all if they're on an 8 to 12 hour fast. So water is usually typically good, just not cups of water, but sipping water is okay. Also, this might require an 8 or 12 hour fast, depends what the doctor's ordered. So again, follow the physician's protocol on preparation and procedures. And again, we want to make sure that there's no eating, there's also no smoking, no gum chewing, or caffeine of any kind, etc. If they're in an 8 to 12 hour fast, this is important because again, this can change the results of the test. And of course, we draw the blood 2 hours after they drink the cola or the glucose cola you see on the screen. And typically it can be done also in intervals as well. And the other important thing is knowing when to stop the test. Now, typically we don't, as phlebotomists, stop any test. We need to get typically a doctor's permission to go ahead and cancel any test that we've done. Now, this might happen because after the patient has drinking the cola, they might get nauseous and even throw up, or feel sick to the stomach, and this might cause us to have to stop and put the test for a future date. But again, we need to contact the doctor and let them know the situation. or after they drink the cola, they eat something or do something they're not supposed to do, that could also cause the test to be stopped and done for a future date. But again, we must also typically consult the physician, let them know that there's a problem with the test, and he will give the final say if we should stop the test or he might want to continue and take the blood test anyway. So always consult the physician before canceling or stopping any glucose test. Now let's talk about blood cultures and why a doctor will order blood cultures. One reason is to check for septicemia. If a patient comes in with the symptoms of fever, chills, or tachycardia, the doctor will order blood cultures to determine if there is a bacterial infection that's circulating through the blood throughout the body. Now, if there's no symptoms, but the doctor suspects that there might be a bacterial infection, the doctor will check for bacteremia. And again, we might also check for an antibiotic sensitivity on the patients. This is what is used typically for blood cultures. Now, in doing so, we use two blood culture bottles, an aerobic and anaerobic. And typically these are timed tests. We might have to go back for a second set. So what you would do is you'd go in with the two bottles of aerobic and anaerobic and draw from a particular venipuncture site, and then come back 15-20 minutes later to collect another set from a different venipuncture site altogether. You will never draw from the same venipuncture site you did for the first initial blood cultures. And if you're drawing a neonate or an infant, you will use an aerobic bottle only. Unless the doctor suspects an anaerobic infection, you will use an aerobic bottle. And that usually comes with a pink top instead of a lavender or a red. And when you prep the site, you will use a ChlorPrep wipe, not an alcohol prep pad. A ChlorPrep wipe is used, and after you do that, you will never repalpate the site. And again, no repalpating after you use the ChlorPrep wipe for a blood culture collection. Now let's talk about therapeutic drug monitoring. Evaluate and manage medication therapy. Now, this is determined if the medication that the patient is on is too weak or too toxic for the patient. And also we do types of blood level checks, which is usually a trough level, when the drug level in blood is collected when the lowest serum concentration is expected. That is usually just before the next dose. And also peak levels. And this is usually 15 to 30 minutes after the medication has been given. The highest level of drug is expected at that time. Now let's talk about toxicology screening. This can be done with blood or urine. And we would measure legal and illegal substances through blood or urine. And of course, we have to make sure we take right preparations to do so. We need to get consent from the patient. Now, this can come also from a court order if the patient is suspected of something of an illegal activity, DUI, or some kind of accident that the police officer might have suspected the patient to be on some kind of drugs. We need a court order consent. We also need a chain of custody, and the said chain of custody form is added onto as the test specimen travels from person to person. That gives complete accountability of a test sample, as well as a list of medications. So when you also need a list of medications the patient might be on to determine outside of the legal or illegal substances and be able to measure that out. Thank you, and this is the end of Special Blood Collection Procedures brought to you by phlebotomysolutions.org.